Hi, I'm Dr. Harish. I'm a senior oncologist, both in solid malignancies and hemato oncologist, and I'm an expert in bone marrow transplant physician. So I work in Cytecare Hospital, where we treat many of the cancers, including blood cancers. So previously, for blood cancers, as you people may all be aware, that we use a treatment called bone marrow transplant, where we will be changing the environment or the cells in the bone marrow. So that was now it's becoming slowly an old treatment, the bone marrow transplant, and now what is taking over as a novel treatment is something called CAR T cell therapy. CAR T cell therapy is you can say an advanced form of bone marrow transplant, where the patient's immunity will be enhanced by changing the genes in our immune cells by adding new immune elements, where the body's immunity will be able to act against the cancer cell, and the body's immune cells are finally going to take care of all the cancer cells. So this is a novel advance in the treatment of cancers. Specifically, we call something called leukemia, B cell leukemia, and in lymphomas as well as in multiple myeloma. In this disease, we have identified a certain immune dysfunction which causes this cancer. So the same can be addressed by enhancing the immunity by developing a particular immune cell against this particular antigen which is responsible for the tumor. So in olden days, you can say bone marrow transplant is like a carpet bombing. The whole immunity, we used to suppress the immunity of the patient, and we used to take separate immune cells from what we call as a donor, that is some other person who is not having the cancer will donate his stem cells, and which will be given back to the patient. So that is what we used to do in bone marrow transplant. So the newer advance is we are not going to take anyone else bone marrow cells. We all have immunity in our body, so we collect those immune cells. The collection process is just like a blood donation, and once we collect these immune cells, we expose them to lentivirus, we call it, and where we genetically modify the patient's immune cells so that the immune cells are able to identify the cancer cells and attack them. So once we collect those immune cells of the patient in the laboratory for the next 10 to 15 days, it is going to be genetically engineered so that the body immune cells which were previously not able to identify the cancer cells, now they will be able to identify the cancer cells. So this is a genetic re-engineering sort of therapy, and this is the most advanced form of immunotherapy which is available, and we should be fortunate being Indians, because apart from Europe and America, India is the only country which has got its own product, research molecule, and it's a great news for us. And also the treatment here is going to be around 20 to 25% of the cost of treatment as compared to what we get in advanced countries, so that it's cheaper and it is better, and it is the most novel form of treatment which is available. So at Cytecare we have facilities to do bone marrow transplant for all sorts of hematological malignancies, B cell ALL, lymphomas as well as multiple myeloma. In fact, we are proud to say that we are one of the what we newer only few centers in the country which offer this sort of treatment. Thank you.